Namaste friends. Would you like to gather some information about Whipple surgery in cases of pancreatic cancer? If yes, then this is the right place for you. Friends, despite being the rarest type of cancer, pancreatic cancer causes about 18% of mortality. It is known to be the most aggressive type of cancer which has a very easy spread. However, when detected at the right time and the right stage, given a right treatment, it is still curable. This is precisely the reason why medical experts has planned this initiative of educational videos so that the patient can take informed decision. Before I start, I would like to introduce myself. I am Dr. Shita Nangaonkar from Medical Experts, and today we are going to discuss various aspects of Whipple's procedure under different criterions. So we are going to learn about what is Whipple's, types of Whipple's, best indications of Whipple's, the contraindications of Whipple's, the risk factor involved, the life expectancy, the success rate, and so on. Today in this discussion on Whipple's procedure, a very renowned doctor of West India, Dr. Ganesh Nagarajan, would be joining us with his expertise of knowledge. Friends, let me tell you that Dr. Ganesh Nagarajan has a vast experience of about 18 plus years into this field. He has done his fellowship in hepatobiliary pancreatic surgeries and liver transplantation from Paris, and he is currently the director of hepatobiliary pancreatic cancer surgeries in Max Nanavati Hospital. So let's start with the best of the interview. So hereby, I welcome Dr. Ganesh Nagarajan to Medical Experts Awareness Initiative. Good afternoon, sir.
Good afternoon.
So, sir, as you had a lot of experience on this, we would like to start from the patient perspective to have an overview on what is Whipple surgery.
So Whipple surgery is one of the most complex operations that we do in the abdomen for cancers. So this is usually done for pancreatic cancers. So usually the pancreas has three parts: the head, the neck, the body and tail comes together. Okay. So tumors in the head of the pancreas, that's the first part of the pancreas. When these cancers, need surgery, what we commonly do is a Whipple's operation. So whether it is a pancreatic cancer or a lower bile duct cancer or what we call as a periampullary cancer, this is all one complex, and all of these require a Whipple's operation. So this is it is a fairly complex operation that involves removing the head of the pancreas, the first part of the small intestine called the duodenum, the lowermost part of the bile duct, and then involves joining back the pancreas, the bile duct, and the stomach into a loop of small intestine. So this is what, in a nutshell, is a Whipple's operation.
Okay, that sounds really very complex, sir. So I would also like to understand, so what are the other types of Whipple procedure as we know?
So Whipple's operation is basically, there are different, essentially Whipple's is, it's done for the cancers that I mentioned earlier. And sometimes the Whipple's operation can have other elements to it, like, taking out a part of the vein. So just behind the pancreatic neck lies a vein called the portal vein, which takes blood from the intestines to the liver. Sometimes these tumors involve this vein or a part of the vein, and we have to take out a part of the vein and join it back. So sometimes the Whipple's procedure can involve a vein resection also.
Okay.
Yes. So essentially so it's either a Whipple's or a Whipple's with a portal vein resection.
Okay. So if the patient needs to know what is the type of query, or what is when should I approach a doctor, or when should I know that Whipple's probably can be something which is indicated for me. So how will patient come to know at least about it? I have a hint about it, you can say.
So most patients with these, this is a tumor that presents in a very, very insidious form. Sometimes patients don't know about it till very late. Sometimes, one of the commonest presentations of this cancer is jaundice. Often
Okay.
patients think that jaundice is probably a medical jaundice where they just keep taking, herbal medicines, local medicines. They feel it will just settle down with time. And sometimes these jaundices don't settle down and they just keep increasing. And that happens along with some weight loss and, especially in older patients. And those are the ones where one should suspect that it could be not just a routine jaundice, but a jaundice because of pancreatic cancer. And those are the patients who may require a Whipple's operation.
So I would like to understand from the patient's perspective, what are the benefits of Whipple surgery over any other surgery?
Benefits of, so see, actually it is in pancreatic cancers, the way we look at it, overall we have, if we have 100 patients coming to us in the clinic with a pancreatic cancer, only around 15 of them will be eligible for a Whipple's operation.
Okay.
A large majority of them will come with metastatic disease where the disease is spread and we cannot offer them surgery. So if the patient is a candidate for a Whipple surgery, he or she is already in the lucky 15% where this disease is at least treatable, or there's a potential for cure. So that is how pancreatic cancer behaves. It's unfortunately one of the most aggressive type of cancers.
Absolutely so.
Yeah.
So also we'll like to understand whether with the Whipple surgery, which are the other, triple bypass, or which are the other surgeries that can be compared with, and what are the benefits from that?
So triple bypass is only a palliative surgery, and it used to be done 15-20 years back when endoscopic stents were not really available. Even now, sometimes we have to do it if the stenting has failed or technically it's not possible. So bypass is so in Whipples, you actually remove the tumor. We get the tumor out, and that is a potential for cure for the patient. On the other hand, when you do a triple bypass, we are only bypassing the bile duct. So we are doing a bypass for the bile duct and a bypass for the stomach. But the tumor essentially remains there. This is usually done for inoperable tumors where you can't get the tumor out because it is spread or because it's involving big vessels or it is involving, it is spread to other organs. And historically, people used to do these surgeries to try and alleviate the symptoms. So at least the patient, the jaundice comes down. So, patient feels a little better. Or if the patient is not able to eat because the stomach is blocked, a bypass for the stomach. So this is what used to be done. Today with endoscopic stenting, we are doing less and less of this because, without having to operate the patient, we are able to put in a stent into the bile duct, put in a stent into the stomach or the duodenum, and they are able to start eating and, relieve the jaundice also. So triple bypass is a surgery which is not commonly done nowadays because of better technologies available. And it is not a curative option at all. So there is no comparison between a Whipple's and a triple bypass. A triple bypass is a palliative surgery to just alleviate symptoms. Whipple's is a potentially curative surgery.
After Whipple surgery, would they require any kind of chemo or radiation?
Most patients may require chemotherapy after a Whipple's operation. It depends on their final histopathology report. But nowadays, most patients after a Whipple's will need chemotherapy to complete the treatment. Some patients we are giving chemotherapy and radiation before the surgery. This is to try and shrink the tumor. These are called borderline resectable pancreatic cancers, where they are, locally a little bulky tumors. They are touching the veins, they are touching the artery. We want to shrink these tumors with chemotherapy or radiation or a combination of both so that we are able to operate them and give good results. So nowadays, often for pancreatic cancers, we have to give chemotherapy first, then operate and then complete the other cycles of chemo.
Okay, perfect, sir. So we will like to understand more on the steps that are taken during the Whipple's procedure or surgery.
These are the steps so basically the patient will have a cut on the abdomen. Sometimes this can be done laparoscopically or robotic, but the outcomes of laparoscopic or robotic Whipples are sometimes not as good as open surgery. It depends on the type of tumor, it depends on the type of pancreas, it depends on the size of the duct, but it can be done minimal access in some patients. But a vast majority of Whipples across the world is still done by open surgery. So the patient requires a cut on the abdomen. The steps are very complicated, very difficult to explain. But overall, what it involves, as I said, is removal of the head of the pancreas along with the duodenum. That's the first part of the small intestine. The bile duct is cut. The gallbladder has to be removed along with this. Once all the tumor is out completely, then we take a loop of small intestine. We join it back to the stump of the pancreas. The second joint is between the bile duct and the small intestine. And the third joint is between the stomach and the small intestine. So there are 3 joints involved when it comes to a Whipples. The entire recovery process of the patient depends on how these joints heal. So, the pancreatic joint is the most precarious. That is the one that sometimes in around 15-20% of patients, there can be a leak from the pancreatic joint site.
So in continuation to the same, as we are talking about the recovery part of it, I'm sure that the patients would like to understand what is the approximate. I understand that a precise number of days would not be able to give away. But what is the approximate time period that the patient needs to recover, as well as if there is an international patient traveling, then how much time period they have to stay in India?
So normally, a patient who has a smooth recovery, and 80-85% of patients will fall in that category, will go out of the hospital by the 7th or the 8th post-operative day. So you get admitted a day prior, the next day is the surgery, and within a week the patient is ready to move out of the hospital. For international patients, we always suggest to stay in, close to the hospital for another week after that. Get the sutures out, make sure the wound is healed, make sure that there's no other issue, and then they can go back to their home country. So overall, that is our recovery period, around a week in the hospital, a week after that in close to the hospital. The patients, 10-15% of patients will have a little prolonged stay, which may be another 4 or 5 days in the hospital, maybe another week in the hospital, depending upon how they are recovering. So, but otherwise 80-85% of patients will be home in a week's time.
Okay, sir. So approximately we can say 2 weeks of time is average time that would be recovered.
Yes.
1 week in hospital, 1 week outside the hospital.
That's right.
But in cases of any complications or any other risk factors involved, then the stay may get prolonged, right,
That's
sir?
absolutely right. Absolutely right.
Okay, sir. So coming to the next question, sir, I'm sure that the audience would want to understand this question prominently about the life expectancy after Whipple surgery.
The prognostication after a Whipples in terms of long-term life expectancy is very variable, and it depends on the histopathology report. So whatever we remove, we send for testing. That report will tell us what is the stage of the cancer, and based on the stage, based on the nodal status, whether the lymph nodes are involved or not, based on that, we can overall give the patient an idea. Usually periampullary tumors, that is, the ampulla is the point where the bile duct and the pancreatic duct open into the intestine. So there are tumors which involve that area, that's called periampullary tumors, for which a Whipples is done. Those patients do significantly better than pancreatic cancers. So those patients have almost a 60-70% cure rate, as in 5 years survival. And when we talk about 5 years survival, it's 5 years and beyond. On the other hand, pancreatic cancers overall, around 30-40% of them will reach the 5-year mark, especially if they are node negative. If they are node positive, then the survivals dip even further. So overall, pancreatic cancer is not a great, in spite of all the technology, surgeries, chemotherapies, a lot of them will have recurrences in the future. At least 50% of them are likely to recur in the future. But that's why regular health checkups, we have a protocol and we call them at regular intervals to check, and then we can take decisions accordingly. So that's broadly about how people survive after a pancreatic resection, after a Whipple's.
Right, sir. So as we are talking already about, the recurrence of the pancreatic tumors. So what should one patient who has already undergone a Whipple's, let's say, and have had pancreatic cancer, what are the different tests they should keep on doing in their routines?
No, so normally in the first year, we tell them to get blood tests done every 3 months along with a sonography and a tumor marker level. And alternatingly, we do sonographies and CT scans to look at the liver, look at other organs to see if the disease is coming back somewhere. In between of that, they can lead absolutely normal life. So first year every 3 months and then every 6 months, just basic routine blood tests, tumor marker levels, and one form of imaging, either a sonography or a CT scan.
Perfect, sir. That was a great explanation and an overview on the whole. So we would also like to understand if there are multiple complications that arise from this, as you're explaining the process to be so complex. But we would like to understand what are the most common complications that you have seen.
So the leak from the pancreatic joint site is the most common, that is the complication that is most relevant. The other complications can be just, either small wound infections, or sometimes the patient, they have some lung issues, they don't breathe well. But those are all small medical issues that get treated just with simple measures like good physiotherapy or just a change in antibiotic or wound care.
So in the same context, I would like to also ask whether there are any contraindications or any such comorbidities that are there in patients which are a complete contraindication for going to Whipple's procedure.
So if the cancer is spread to other organs like the liver or the lungs or the bones, or the nodes are extremely large, or it's spread to other bones, the nodes which are not in the vicinity of the pancreas, all these would be contraindications for a Whipple's. So any metastatic disease would be a contraindication.
Okay, sir.
And of course, the other contraindication if the patient is not fit for the surgery because of other medical issues like, a cardiac issue, or, some patients have very bad lungs. They can't tolerate such a long anesthesia. So those would be the other contraindications.
Okay, absolutely got into that, sir. So one more question which comes very frequently by most of the patient is the success rate of Whipple surgery.
So success can be defined, as I said, in two ways. One is the immediate success, where the patient has been operated, the tumor is out, the joints are done, everything is healed well and going home. So today, overall, 98% of patients will eventually go home after a Whipple surgery. 1 to 2% can have serious life-threatening complications and they may not survive the surgery. But otherwise, 98% of patients will go home. Around 10 to 15% of patients will struggle and go home, will have some complications which need antibiotics, drainage, and they will stay longer in the hospital, but eventually go home. And a vast majority of them, 80-85% of them, will go home smoothly. And that is, that is the statistics that are there across the best centers in the world. And I think we have all similar results.
Perfect, sir. Perfect for that. So thank you for such an informative, interaction. One more thing, that is the last question from my side, sir, that most of the patient would like to understand, and it can be a myth buster as well for many patients who look at Whipples as a very costlier procedure. So involving the cost. So if we have to talk in terms of percentage, how much is Whipple costlier to the traditional way of treating it? Then how can we term it, sir?
So, in fact, there is no alternative to a Whipple's operation. There is no other way of treating a pancreatic cancer other than a Whipple's operation. So, So if a patient is eligible for a Whipple's operation, he or she should get it done because there is honestly no other alternative to it. It's like a life-saving procedure. So if the patient is eligible for it, they have to get it done. Um, uh, then it depends on the costs. Will of course depend on various factors. Will depend upon whether the patient is the type of, in our hospital, it'll depend on the type of bed that they choose, the kind of facilities that they want. The surgery remains the same, but there are various categories of beds. So based on which bed, some are single room, some are twin sharing, some would be the economy wards. So the costs will differ based on the kind of bed that they take. The treatment, the care, the surgery remains absolutely the same. And it is quite,
Perfect, sir.
it is not unaffordable. We normally take great efforts, our whole team, everyone, including the administration, the marketing team, the international team, they take a lot of efforts to ensure that no patient is deprived of a potentially curative surgery for want of money. So we do try and help them and help them in whatever way we can.
Perfect, sir. Thank you so much, Dr. Ganesh, for joining with us and giving such a information on Whipple surgery, which is, you can say, evolving, one of the evolving procedures, and people are not yet so aware about it. So thank you so much for this session. Friends, I would like to emphasize on this part that every patient is different and all the information that is provided in this video varies from case to case. Okay, so this is an overview that you should take as a part of information, but of course your case might have different factors such as comorbidity, such as the staging, such as the grading, and the other treatments available. So thank you, sir, here for joining with us.
Thank you. Pleasure talking to you.
Yes.